Okay, so now we have a real human bone, and this is the humerus, and this is the single bone of the arm region of the upper limb. The arm is the proximal section of the upper limb, essentially between the shoulder and the elbow. And the forearm, bones we'll look at in a moment. The forearm section is the section between the elbow and the wrist. Okay, so we have the humerus and the diaphysis, since this is a typical long bone, is here. We're going to start at the proximal epiphysis and then work our way toward the distal epiphysis. Okay, so I'm going to rotate this bone. First landmark we're going to look at is this large, round, smooth surface. It's kind of half of a sphere, almost. This is the head of the humerus. Okay, now if you have a head on a bone, you always have a neck. Okay, and the humerus actually has two necks. Okay, it has first its anatomical neck, and the anatomical neck is always the section of bone that is directly attached to the head. Okay, so that would be this area that I'm kind of tracing around with my finger. Okay, then we have the surgical neck, and the surgical neck is the region that I'm encircling with my thumb and my second digit here. Okay, and so the reason that the humerus has two necks is because usually in a bone the neck is a weak area where breakages are likely. In the humerus, this anatomical neck is actually in a very sturdy portion of the bone. If you're going to have a break at the proximal end, it's usually right in this location. So this location has been referred to as the surgical, sometimes as the medical neck of the bone. And many times if you have a break at the surgical neck, you do require surgery to repair it. Okay. Also on the proximal epiphysis, we have a couple of bumps, one big bump and one small bump. The big bump is the greater tubercle. The smaller bump is the lesser tubercle. And you'll see that there is a deep depression or chasm between the two of them. That chasm is the intertubercular sulcus. Okay, so a sulcus is a name for an indentation, and we have this indentation in the bone. The other name for this indentation is the bicipital groove, and it's called the bicipital groove because it is one of the tendons of the biceps brachii that actually creates this indentation. Okay, those are all of our landmarks at the proximal end. As we kind of start here at the greater tubercle and work our way down to about mid-diaphysis, we have this roughened area of the bone. This is the deltoid tuberosity. This is the insertion point for the deltoid muscle. Okay, and the name may not be as easy to remember, but the location is, it's the only landmark that is in the diaphysis of the humerus, the deltoid tuberosity. Okay, at this point we're going to shift our focus down to the distal epiphysis, and you can see we have several different articular surfaces, and we also have some little indentations on the bone. Okay, so we'll start with the articular surfaces. This articular surface that's kind of round and smooth is called the capitulum. Okay, and this is the articular surface where the head of the humerus rests. Okay, now this one that starts here on the anterior surface and goes all the way around to the posterior surface is the trochlea. Okay, and the trochlea is the articular surface for the ulna. Okay, and it has to go all the way around because the ulna makes a nice hinge joint and it has to kind of move this way. okay, over that surface. Okay, so the trochlea goes all the way around from the anterior side to the posterior side. Now remember, the ulna has those little pieces that kind of stick out from its trochlear notch, so the humerus has to give the ulna some places to tuck those pieces in. Okay, so anteriorly, the depression here that is just slightly proximal to the trochlea is the coronoid fossa. Okay, so the coronoid process of the ulna sticks right into that coronoid fossa. On the posterior side, the much larger depression that's next to the trochlea is the olecranon fossa. Okay, and this is where the olecranon process of the ulna tucks in when the arm is straightened or extended. Okay, now on the anterior side, we also have this other smaller depression. This is the radial fossa. And the radial fossa is what allows the radius to tuck up into the humerus a little bit. Both the coronoid fossa and the radial fossa allow us to fully flex our elbow joint. Okay, so a piece of the ulna, the coronoid process, would tuck into the coronoid fossa, and the edge of the head of the radius tucks into the radial fossa. Okay, now in addition to these articular surfaces and depressions, we also have the side pieces of the distal end, and these side pieces are the epicondyles. When you see the word epicondyle, that means it's next to and supporting a condyle or an articular surface. Okay, so the lateral epicondyle is the smaller of the two epicondyles here in the humerus. The medial epicondyle is the one that's very large, and it's so large because there are several forearm muscles that form attachments to this particular piece of bone. Okay, and this is what you can feel if you palpate the medial aspect of your elbow. You can feel this big bump on the medial part of your elbow. Okay, and this is the medial epicondyle. This is also where the ulnar nerve runs past. So if you hit your elbow really hard right here, you basically squeeze that ulnar nerve between the medial epicondyle and whatever you've hit. And that's when somebody says they've hit their funny bone, but it doesn't feel very funny. Okay, so that's the humerus.